Hello, I'm Lindsay Woodford and I'm a sports psychologist and academic at the University of the West of England, Bristol. And I'm going to talk to you today about my research, which investigated the impact of the Covid-19 pandemic social distancing measures on athlete wellbeing, a qualitative study utilising photo-elicitation. Introduction. On the 11th of March 2020, the World Health Organization declared the coronavirus disease 2019 outbreak as a pandemic. The situation is evolving rapidly, with global case counts currently just over 33 million and death rates over 1 million worldwide. In addition, major sporting events have been postponed or cancelled, and social distancing measures that have attempted to suppress and control the coronavirus outbreak have had a profound impact on athletes by restricting their movement and prohibiting access to training facilities. This isolation, disruption to normal training routines and competition cancellation could be having an adverse effect on the mental health and well-being of athletes. Whilst mental health is a major resource for athletes in relation to their performance and development in sport, high rates of psychological distress and disturbance have been reported amongst athletes. Indeed, the International Olympic Committee consensus statement on mental health summarised that mental health disorders are common in elite athletes and that these may have sport-related manifestations that could impair performance and well-being. Considering the increasing number of mental health problems being reported in the athletic population, the challenges that the pandemic presents to them, and recent research identifying the adverse effect of social distancing measures on mental health, athletes could be considered an at-risk group during the current COVID-19 pandemic. Indeed, this is reflected in the findings of a recent study of 692 South African elite and semi-elite athletes, which highlighted that COVID-19 lockdown period had significant physical and mental effects on athletes. These included physical deconditioning, altered sleep patterns, worsening nutrition, uncertainty on return to sport, and feelings of depression. So whilst the current pandemic has presented sport and exercise psychologists consultants with challenges and opportunities with how best to support athletes' sport performance and well-being, in order to support them better during this global health crisis, further research is needed to investigate how these social distancing measures are affecting athlete well-being. So the aim of the current research is to investigate the impact of these. Method. A qualitative design was employed and the data was collected by combining individual semi-structured interviews with participant-driven open photo-elicitation methodology. A total of 13 elite athletes representing 10 different sports who were unable to train or compete due to government-imposed lockdown measures participated in the study. So whilst the severity of the lockdown measures differed across the countries, none of the athletes in the study were allowed to leave their homes to participate in organised sport. Participants that were excluded from the research included those with clinical mental health problems, those who had contracted COVID-19, those under the age of 18, recreational athletes, and those residing in countries who did not have to adhere to lockdown measures. So, data collection. Participants were asked to take photos that they felt represented their experience of the current COVID-19 pandemic as an athlete, and they were asked to discuss these in a follow-up interview. Participants were made aware that the photos were conduits aid discussions and would not be part of the data analysis. It was only the associated narratives that would serve as the data set. And due to the exploratory nature of the novel research, the data analysis used was inductive thematic analysis, as guided by Brown and Clark. Results. So, following the participant-driven photo-elicitation methodology, participants provided the researcher with photographs that they had taken which documented their experience as an athlete living in lockdown due to the COVID-19 pandemic. So, though the images were important to elicit discussion, they were not part of the analysis. Thematic analysis was applied to the participants' discussions of the images and identified three main themes which highlight their experiences of lockdown as an athlete. These were threats to well-being, protecting well-being, and reflecting on athletic identity. Threats to well-being. Within this theme, participants discussed the challenges that they experienced as athletes adhering to government-imposed social distancing measures during the first wave of the COVID-19 pandemic. Threats to wellbeing encapsulates the athletes' discussions around their diminished emotional and mental wellbeing, whilst acknowledging their threats to their social relationships and physical health. Subtheme 1. Lockdown exacerbated existing conditions. For some of the participants, the lockdown exacerbated existing mental health conditions, which pose a further threat to their overall well-being. Jess, one of the participants here, explained how her period of good mental health prior to lockdown protected her during the period of isolation, but she expressed concern about her peers and their reluctance to ask for help. I'm really lucky and really grateful that my period of mental health, really poor mental health, I suffered with depression, ended about mid to late January, because if it wasn't, and I was in the same state as I was in my really bad time, like in 2018, I'd really be worried at this time, really worried. So I'm worried that if people do feel as I did during that time, and they're not telling anybody, and no one knows, because there's only a certain amount of times you can ask if people are okay, I am really worried that it could become more of a clinical problem, and no one would know it. Subtheme 2. Reduced access to social support and outdoor space. Many of the athletes emphasised the vital role social support played in their mental well-being, and that as a result of lockdown measures, the social support which they would normally obtain and provide through group training was lost. Some athletes spoke of what they missed about their training and what the sport meant to them. I associate swimming with different things. I miss the team. I miss the coach pushing me to do my best. I miss the accountability. I miss the actual sport itself because I really, really love swimming and it makes me so sad. I miss my friends at swimming and the dry land training. I miss the competitiveness and the meets. I miss everything swimming is in my life. Theme 2, protecting well-being. Within this theme, participants discussed how they initially engaged in maladaptive behaviours at the beginning of the lockdown period, but that over time they developed coping strategies to protect their well-being, such as developing new routines and taking part in sport and exercise for fun. Subtheme 1, replacing old routines with new ones. A key aspect which athletes felt that they lost in lockdown was their training routine, which for many provide a structure to their day. So for Rachel in the example below, the lack of routine affected her sleep, her alcohol consumption and motivation. I had nothing to do, literally nothing to get up for, and I lost momentum. I went to bed later and later every night and then got up later every day. And within a week and a half, I couldn't sleep. I was staying up late watching Netflix and then going to bed late, having crazy dreams, probably because of the alcohol, but also because everything was just weird. Then waking up really late, and the whole day I felt like I was on the back foot. Nothing was getting done. It was one long thing of sleeping and staying up late and not getting much done at all. My routine went out the window and I felt awful. Now I have one. It feels much better. Subtheme 2, exercising for fun. The narrative around training changed over the course of lockdown, and the athletes began to talk about how their participation in sport was not just about performance. So Hannah, in the first example, described how her swimming was now focused on exercising for pleasure as opposed to training for competitions. We have a pool. It's not very big, but I swim in the morning. It's now my favourite part of the day, even though it's quite cold. It's not difficult. It's not like training to keep fit. It is really fun. Every time I get out of the pool, I feel refreshed. It's a good start to my day, and it lifts my mood. Subtheme 3, new non-sport related hobbies. So many participants spoke of how they'd taken up new hobbies to fill their time, now that they weren't able to dedicate it to their sport, and this helped protect their well-being. So Olivia, a biathlete from South Africa, described how she'd taken up photography to help pass the time, and also as a way of expressing her feelings during lockdown. During the lockdown and having all this free time, I've gotten into photography, right? So I've been playing with the camera, and me peeking through the fence in that photo, I was trying to get the same feeling as being isolated from other people, and that was the best thing I could do, being isolated from the outside, not being able to leave, and not being able to have the freedom of choice, and that sort of stuff. Theme 3, reflections on athletic identity. This theme is defined by participants' reflections on their athletic identity during the pandemic. Initially, participants discussed how the cancellation of sporting events facilitated a shift in their focus, allowing them to work on other aspects of their identity, such as being a student or pursuing vocational careers, which for some was considered protective for their well-being. For others, the period of isolation prompted a cost-benefit analysis of the participation in elite sport and the impact it had on their well-being. Subtheme 1, Dual Careers Protect Identity. Many of the participants in this study identified as dual career athletes who are pursuing both sporting excellence and an academic or professional career. Jess spoke of her identity as a student athlete and how having a dual career was protective for her well-being during lockdown. So when she couldn't fulfill her role as an athlete, she was able to shift her focus to her other identity as a student. So in the example below, she refers to a photo taken of her academic reading, which reflects her dual identity. Yeah, I think student athletes are struggling with their well-being. It might not be to the extent of needing maybe clinical mental health intervention at this point, but definitely some element of their identity is gone. Because you're not a normal student, and you're not really an athlete, in a sense, anymore. The photo of all the research papers is to show my identity as a student now, and that's what I've been doing with the majority of my time. Being a student athlete has been protective for my well-being, definitely. In terms of my identity, it has shifted a little bit. Subtheme 2, questioning participation in elite sport. So whilst some athletes considered how temporarily losing the athlete part of their identity enabled them to explore new hobbies or develop a dual career, for others the spare time had them questioning their role as an athlete and if achieving athletic success was worth the threats to their well-being. But now it's like, bloody hell, we're really onto a good thing here, and we could have gone into the top league and had an amazing time. But that's disappeared as well. And the longer it's gone on, you realise that it's only 1 year, 1 season, and seasons come and go. And I've done 13 of them or something. And as much as winning and being at the top is great, it doesn't mean anything really. Not when you really think about it. It's just a moment in the sun, isn't it? Discussion. The athletes in the present study reported that restricting physical activity had an adverse effect on their well-being. And furthermore, it was found that participation in sport was used as a coping strategy for mental health conditions such as depression and anxiety. And without these, athletes with pre-existing mental health problems develop maladaptive behaviours such as increased alcohol consumption and binge eating. Recent research conducted during the pandemic has reported that higher levels of physical activity were associated with lower levels of anxiety, suggesting that physical activity can help protect against some of the stresses associated with the crisis. And that was recent research conducted by Antunes et al. Number 2, social isolation threatens well-being. So the current research identified young athletes' feelings of loneliness from the lack of social interaction with their athletic peers and the negative impact this had on their well-being, but they were also reluctant to seek support. It has been reported that periods of reduced physical activity can compound feelings of isolation from teammates, distance athletes from the athletic community, allow less interaction with coaches, and this lack of social support can cause emotional and psychological distress. And this was studied by Reardon et al. In 2019. Strategies to protect well-being. So whilst the study suggests that athletes did experience threats to their well-being in response to the social distancing measures that restricted their participation in sport, they also developed strategies to protect their well-being during the crisis. And this supports previous research conducted by Reardon et al., which suggests that the pandemic, although causing isolation and this being a threat to well-being, that social support plays a vital protective role in response. Negotiating the Covid-19 athletic career transition. So some athletes adapted their training routines to cope with this non-normative transition, whilst others experienced a crisis transition as a result of their lack of resources and ineffective coping strategies. Engaging in reflective practice encourages stress-related growth. So results from this study suggest that athletes in lockdown were afforded a prolonged period of what Eccles and Casimir describe as wakeful resting, and it allowed them to reflect on their athletic participation and make life changes that would protect their well-being during the confinement period and when they returned to sport. So what are the recommendations for practice? So it's paramount that intra and interdisciplinary collaboration between athlete support personnel is encouraged in order to coordinate efforts to help athletes cope with the current global crisis. So, for example, case conferencing between multidisciplinary team members and key stakeholders to encourage athletes to adapt their athletic routines to facilitate a positive adjustment to the constraints of social distancing to help protect against the development of maladaptive coping strategies. So this could include goal-setting strategies that focus on a mastery approach that encourages personal development over a performance approach that's focused on outperforming others. Second, it's recommended that efforts should focus on developing social support within teammates and coaches through incorporating team activities, virtual or in person if possible, that provide an opportunity to check in and promote social connectedness. With increased accessibility of virtual communication in response to the pandemic, this is an opportune time to capitalise on these new technologies to help enhance athletes' well-being. It's also recommended that athletes that have pre-existing mental health problems should be identified early and offered appropriate psychological support from qualified mental health practitioners, and this needs to be done at the outset of the period of isolation in order not to further exacerbate their condition. And lastly, in line with previous career transition research, athletes are encouraged to pursue dual careers to facilitate the development of multiple identities that can help protect well-being during times away from sport.